So hey guys, it's Mrs. Malott. It is summer and I am here recording my very first lecture video. So bear with me because it is a learning process for all of us. But if you have found Chapter 1's learning guide on the website, you'll notice that there are 4 objectives for the first lesson that are noted. The first one's identifying how healthcare has changed throughout history. Number 2 is defining holistic care. Number 3 is identifying types of healthcare organizations. And number 4 is identifying the structure of healthcare organizations. So what you guys need to know about this is that with these objectives, these are what you should take notes on. These are the areas where the test questions are going to come from. They're the most important parts. Not that you don't need to know everything else that we might be talking about, but they're kind of the most important parts that you kind of need to pay attention to. So we're going to go ahead and get started. If at any point you need to take notes or something, with the benefit of this being on the video is you can pause it in order to do that. There also will be a link provided for the PowerPoint notes that if you want to follow along with the PowerPoint, you can have that access available as well. So chapter 1 is called the healthcare system. So with healthcare, you kind of can't understand where we're at unless you know where we've been. So they start by talking about some of the ways that healthcare has been done in the past. So a long time ago, doctors that were taking care of people were general healthcare people. They were trained more on how to handle certain procedures versus the understanding of how everything works. So in other words, they might be trained on how to fix a bone or what to do if somebody has pneumonia, but maybe not necessarily they didn't understand everything or knew how everything worked and didn't have training in a whole bunch of areas. There were these people that would go from town to town as well, and they were called charlatans, and they would sell cures. They would sell snake oils and things like that and promote them as a way to cure illnesses when maybe necessarily that wasn't so. But that is the idea behind them. They're called charlatans. But for the most part, when people were sick back in those days, they received their care in the home. Doctors would come to them. They would go to their house, take care of them, come back and check on them, maybe even stay with them for the most part. If you fast forward though to today, doctors now have to go to school. Before, they didn't really have to. Now doctors go to undergraduate school for 4 years of college, then they go to 4 years of medical school, and then if they want to be a specialist, they go on from there and have even more training. So there is a lot more education preparation than there used to be. And now patients are taken care of in their home. If we need to go see a doctor, we go to the doctor. We go to the doctor's office, or we go to a hospital if we're sick, those kinds of things. What used to be called a family doctor is now called a general practitioner, and then they have all these different specialists to help them. So for instance, if you need a child to be looked at, then there's a pediatrician available. Or if you have a broken bone, you can go to an orthopedist, things like that. And in healthcare now, we try to look at more than just what is wrong with the person. We try to do what's called a holistic approach, which means that we look at not only what's wrong with them physically, but we look at the spiritual aspects of the person, emotional aspects, and try to make sure that everything that we do will help the patient get better. So that's kind of a brief past and present of healthcare. So now we're going to kind of switch gears a little bit and talk about different types of healthcare organizations. Excuse me here a second. The very first of which is a hospital. That's one of your most well-known types of healthcare facilities. And when you receive care in a hospital, you're called a patient. And if you stay there overnight, you are an inpatient. But if you go there for whatever you need to be seen for and then go home, you're called an outpatient. So it might be that you have lab work, or you get an x-ray and then go home. Or it could even be that you have surgery and go home the same day. Anytime that happens, we call you an outpatient. Another kind of healthcare organization is a subacute care unit, sometimes called a skilled nursing unit. So these kinds of facilities are for people who aren't quite sick enough to be in the hospital, but aren't quite well enough to be home either. So they're kind of that in between, like they don't need hospital care, not quite ready to go home, not quite well enough to do things on their own. So they might need just a little bit of help. Maybe it's therapy or IV medication or something like that, that they just need a little bit of nursing assistance yet before they can go home. And they would still be called patients there as well. The third kind of facility is a long-term care facility. You guys might call it a nursing home. It's also called an extended care facility. Lots of names for these types of facilities. But the people who are taken care of in a nursing home are no longer able to care for themselves. They can't maybe bathe themselves, feed themselves. They can't handle getting their own medications, things like that. Maybe their families can't even do that for them. And so they actually are admitted to a long-term care facility, and it becomes their home. Now, on occasion, there are people who get admitted to a nursing home and stay for a short while and then can go home. But for the most part, they are admitted, it becomes their home, and that's where they will live. And because of that, when you're cared for in a nursing home, you're not called a patient, you're called a resident, because you reside in the nursing home. Another kind of facility is an assisted care facility. Sometimes you may see assisted care facilities with a nursing home. For instance, over in Chambersburg, Menahaven, they have a nursing home, but they also have assisted living on the same property, so that if something happens and they progress to the point where they can't care for themselves anymore, they can go directly into the nursing home. So assisted care facilities are for people who need some help. They are able to do some things for themselves, so they may be able to feed themselves, and they may be able to walk, but they might need a little assistance with bathing or with their medications, with making food. I mean, it could be anything. They just need a little bit of help. And so there's healthcare professionals that work there that kind of provide those types of services for them. And then there's home health care agencies. They actually, it's kind of old time. They go in and they take care of people in their homes. They have people that when they care for them are called clients. Now, we do have home health care here in our area. If you didn't know that, there is home health care through the medical center. There's home health care agencies over in Chambersburg as well. And so these types of facilities hire many different types of healthcare professionals. They might hire nurses to do dressing changes and give medications and administer IVs. They might hire physical therapists to go do therapy with people. So they might hire nursing assistants to go in and help bathe people. A lot of times the clients that are cared for by home health care agencies maybe were admitted to the hospital and came home, or something like that. It can be similar to the last type of facility, and that is hospice. But the difference being is that hospice is for people who are expected to die within the next 3 to 6 months. So if somebody is admitted to hospice, they are not expected to live very long. And the focus for somebody that's in hospice kind of changes. The idea behind that is that we're trying to make the person as comfortable as possible. So they might come, nurses or whomever may come in and give medications, and they might involve clergy people, in other words, like ministers, priests, things like that, in order to meet the person's spiritual needs, and basically just help prepare not only the patient but also the family for, things that are going to happen after the person dies, that kind of thing. And last but not least for the day is the structure of healthcare organizations. Every organization is going to be different. There is one person up at the top, and then each person then has a boss, that kind of thing. So for instance, the best way I can explain this is through the nursing department, because that's what I'm most familiar with. So you have a nursing assistant, and nursing assistants answer to LPNs. LPNs answer to the RNs. The RNs answer to the nurse in charge. The nurse in charge answers to the manager. The manager answers to the director of nursing. The director of nursing answers, and so on and so forth, until it goes up the chain of command, so to speak. You'll have a CEO or a chief executive officer that's in charge of the entire organization, and then they usually answer to the board of trustees. Now, what the board of trustees is a group of community members that kind of oversee what goes on in the hospital. So they're kind of in charge, but they're not employees. They're people from the community. So the CEO is in charge of the entire facility, and they answer to this board of community members that kind of decide what happens in that kind of thing. Each facility is going to be different. So we can't give you an exact. There is an example of what a chain of command might look like in your book, but just keep in mind that wherever you end up working, it's going to look different. I've worked at 3 different hospitals, and each one has been different. What you're responsible for knowing when you work somewhere, though, is who your boss is and the chain of command, so that you can answer and follow, I don't want to say orders, but follow what you're supposed to do in the way that you're supposed to do it. So I hope you understood all that. If you have any questions, please feel free to shoot me an email, and I'll get back to you as soon as I can. One thing I did not mention that I do want to mention is that your book does highlight that the person that's in charge of nursing is sometimes called the director of nursing, or the DON, sometimes called the chief nursing officer, or the CNO. And the focus of everybody, though, everybody who is working with somebody, the focus is really on the patient. The patient's at the center, and the healthcare team works around that person, and everyone tries to do what's best for that person. So, all right, well, that is it for today. I hope this went well for you, since it is the very first time, and we'll get better at this as we go. Thanks, guys. I'll see you later. Bye.